Hey guys, yay! So, how are you? I trust you enjoyed your week. I enjoyed my week and I am so happy to be back. So, today we would be talking about a very fantastic topic, and this topic is Caesarean section. Yeah, C section. Nigeria has one of the highest rates of maternal mortality because patients often decline C-section even when it could save their lives and that of their babies. Now, because they have this belief that any woman who goes through C-section is not a complete woman. That's not true. Now, let's see why you should consider a C-section. Sometimes C-section may be needed to protect your life and that of your baby. Sometimes there may be problems during pregnancy that makes vaginal birth risky. If there are problems with the placenta, such as low-lying placenta, C-section is very necessary. Okay, if your baby is lying in a very difficult position when your baby is breech, C-section is very necessary. If you're expecting more than twins, C-section is very necessary. Or if you have HIV or a deadly disease, mommy, C-section is very necessary. See, note that it is important that you need to unlearn some of these myths and misconceptions around C-section. You know, myth like if you had a C-section before, you won't be able to have a normal vaginal birth delivery. Mommy, that is a very fat lie. Or myth such as when you go through C-section, your healing process will be prolonged. Mommy, that is a very fat lie. Now, some people say C-section is not the will of God. And do you know something? That the will of God is that you are safe, your baby is safe. You know, I've heard a lot of things like, I am a Hebrew woman. Mommy, you are a Nigerian woman and you have a very big God who will go through C-section with you. You know, mommy, you have to realize that when you say you are a Hebrew woman, you don't want to go through C-section because you believe, you have to realize if you're talking because you're afraid or if you're speaking that because you have faith. Those two words, those two, faith and fear, they are two big forces that can determine a lot of things. You know, when a woman is willing to pay the price to be sure that her baby is okay, mommy, that is the true essence of motherhood. I can't imagine you going through the 40 weeks of pregnancy and on that day you're being difficult because you don't want people to think you're not strong enough to push. You don't want you begin to give your doctors and your nurses, those that are attending to you, problems because you have this thing wrapped around your head that you're a Hebrew woman. You're not, but you have a very big God who will help you go through C-section. And C-section, if your doctor tells you that you should go through C-section, your doctor knows what he's saying. He's not saying that because he wants you to pay more, because he wants to eat your money. I believe your doctor wants the best for you and your baby. See, mommy, you don't have any reason to be embarrassed. I know you might be embarrassed or stigmatized because you went through C-section. You don't have any reason to do that. For going through C-section to bring your baby into this world. You don't have any reason because your life is too precious for you to gamble with it. And most importantly, mommy, C-section is not a sign of failure. Rather, C-section is a sign of devotion, that you're devoted to your baby. And that is the true essence of motherhood. So, until I come your way again, I remain your girl, Joy Bakare. Bye.